don't do it. Go home. It's better. I am Franciele Favarin. I am a psychologist. I come from an integrative background, so working with holistic therapists. Yeah, as a psychedelic therapist, I guide people through altered states of consciousness. Theoretically, it's working in altered states of consciousness. As I said, it could be pharmacological induced by psilocybin, LSD, MDMA, or non-pharmacological induced, for example, breath work, meditation, or other types of therapy. It's different from talking therapy because in non-ordinary states of consciousness, we can achieve deeper layers of the mind, which is not often accessible through words. As a therapist, I will help people to make understanding of and making meaning of what they felt. Since childhood, I was drawn to what people hold in their mind. I realized very early that my thoughts were not something that happened to me only, but it was human. And lately, studying psychology, I felt drawn also to the unconscious. So this part of the mind that we are not aware of, but it's also drawn our behavior and how we live our lives. Yeah, my path through Jungian analysis, psychoanalysis, the work with unconscious, the work with palliative care patients were showing me things that were beyond the words, that were beyond what we can talk about it. There are things that we can only feel. And then I was expanding my knowledge, studying about yoga, about meditation and other things that can improve well-being, other integrative practices that can improve how people experience themselves, how they live their lives. And psychedelics was one more layer of this, expanding my knowledge, expanding my studies, and expanding my own journey through healing. And then as a therapist, I felt that it could be something used to also help other people. And it was something that it was being studied in the 60s. Because of the drug law enforcement, it stopped the research about it. But nowadays we are living what it's called the renaissance of psychedelics. So it's becoming possible again to talk about this possibility to use substance, not only, but using substance in treatment. I believe in a societal change, but through personal change. So if each one of us make our part, we are changing collectively. When I interact different with my own emotions, I interact different with others, with my community, and this start making a difference in the culture, in the society itself. The common thread between people who seek this type of therapy, it's the readiness to transform, to change something. Sometimes people have gone through many other different types of therapy and didn't feel that the outcome was what they expected. I think they are in a turning point at the moment. They seek for this edge treatments. That's what it still is nowadays. It's an edge treatment. For people trying or seeking healing, maybe not healing, but feeling better. We are often saying healing, And we create this expectation that when I heal, I will not feel what we perceive as negative emotions anymore, but this is not true. It's part of life, feeling all range of emotions, but not being caught by these emotions and acting through it, but feeling, recognizing it, and being able to control how the reactions are. So people seeking to react or to feel different after they experienced trauma or long periods of depression, chronic anxiety, panic attacks, those are more common symptoms. Sometimes are people seeking for or hoping to find more meaning in their lives, to feel more alive, to reconnect with themselves, to reconnect with divine, and all of them are welcomed. Emotionally, psychologically, I spend time preparing myself first, and then my client also, to go through this process, setting intentions, understanding their inner story, their background, their perspectives about life and feeling, and creating a foundation of trust, this therapeutic alliance, because this is foundational. This type of therapy, it's more about what happens before the preparation, the psychological, emotional preparation, and what happens after, the integration of the content that arrives to make meaningful changes in someone's life and well-being. And legally, I work within the possibilities allowed in Germany. That means in some cases I guide breathwork sessions, which also allows this altered states of consciousness. It's really powerful. It's a deep process, and it only happens with breath, air, so it's legal everywhere. It's a good tool for therapists' use anywhere in the world. And I also support people through preparation and integration when they choose to have an experience on their own. I see this movement as a reflection of a collective hunger for connection, for depth, for something else, maybe sacred. This movement carries risks, and I don't believe it belongs to a clinical settings only. We have seen indigenous community and other communities across cultures and places working with non-ordinary states of consciousness through rituals and, again, non-pharmacological induced methods. And I think it's important to stress it, because many people believe that's only through substances they can achieve these states, and it's not true. But also plants are used in order to change the default network mode. That's normally how we answer things in our daily lives. So it changes the perception of consciousness, and they are doing this for centuries, for millenniums. Would be presumptions from me and from Western white people say that the way of doing it's only in clinical settings, hospitals, clinics, with therapists, whatever. But what is important also to say is, in those community who have been making use of these states of consciousness, they used to live in a different environment, and they had support from the community to go through challenging experiences or to integrate afterwards in the following days, weeks, months, years. Nowadays, someone goes to a ayahuasca retreat, for example, And in 1-2 days, they leave this place and there's no space. No space in the community to talk about. No space with family, colleagues, peers, whatever, to talk about. And then the use can be harmful, can be distressing, can be even dangerous in a way of making someone be so confused about it that they are not making meaning of this experience. It's making questions to yourself when you are seeking this kind of experience with substance or without. So, for example, is there a structure for preparation and integration? Is the person guiding trained? Psychologist, psychotherapist, medical doctor, shaman. Is this person trained to offer this, or just had some personal experiences and now are guiding others? And pay attention, the body will tell the truth. And even though you go to a retreat, you go to somewhere to do this experience, to have this experience, being there, if you're not feeling comfortable, if you're not feeling safe, safety, it's the base to this work unfold in a way that can be meaningful. If someone is not feeling safe, don't do it. Go home. It's better, you know? So ask yourself questions. How do you feel? How your body reacts? So if your body are reacting to a place, to a therapist, to an experience, listen to it. Safety and feeling safe also doesn't mean feeling discomfort. Discomfort, it's part of the process. But this is another thing. It's not being safe, not being able to feel vulnerable. Discomfort, it's part of the process. Safety, it's how the process should happen. There are many come from still the laws that we faced from 60s till nowadays. Things like if you take mushrooms, you will fry your brain. But not only from this, it comes from society. And from society we have many collectively, but personally there's also fear of losing control, fear of losing the mind, fear of not being the same person anymore. Psychedelic therapy, when done with integrity, safety, it's not about escape, but it's actually about facing with honesty these deep fears that might be preventing you to go forward in something else in life. We need conversations. We need to talk about it. We need to have an open space and a safe space, not a judgmental space, to talk about harm reductions and education, right? Education, it's the base, it's the foundation for everything we do in life, and making bridges between the modern scientific discoveries, but also from the shamanic, ritualistic perspective. It's bridging those knowledge and making something else, making something new from it. And most of us, we need stories. We need to know that someone went through it and what happened after. We need to know how was the experience. So I truly believe that talking freely about it, it's a way of destigmatizing. Something that's very, very important to be said here, it's healing doesn't come from the substance itself, but it comes from how we listen. It comes from how we make meaning. It comes from how we integrate what it was found. And it's the process that it's healing. It's not the drug itself, the state itself.